हेलो एवरीवन, गुड इवनिंग। कैसे आप सब लोग? नमस्ते। अभी कुछ दिनों से लाइव शो नहीं हो पाया तो बहुत सारे क्वेश्चंस जमा हो गए थे, तो अभी मैं और डॉक्टर सिद्दीकी जुड़ेंगे और हमने सोचा कि बहुत सारे जो लोगों के क्वेश्चंस रह गए थे उनका आंसर करेंगे। सो या डॉक्टर सिद्दीकी अभी ज्वाइन हो गए हैं। या डॉक्टर सिद्दीकी, विल यू प्लीज सेंड मी द रिक्वेस्ट फॉर द ज्वाइनिंग सो आई विल टेक यू इन। या जयस्पर, थैंक यू। अच्छा, रेशमा ज्वाइन, हाय। अच्छा, सागर वर्मा फ्रॉम सॉफ्टवेयर,
Hi,
ओके।
Pranav.
या हाय, या हाय,
Hi.
गुड इवनिंग, हाउ आर यू? हाउ आर यू डॉक्टर सिद्दीकी?
Fine. And how you are, ma'am?
आई एम ऑल्सो फाइन, थैंक यू, थैंक यू।
Yeah.
So yeah, so today we are going to discuss regarding something about, because बहुत सारे पेशेंट्स के ऐसे मैसेज आते हैं रिलेटेड टू मेल सेक्सुअल डिसफंक्शन। तो मेल सेक्सुअल डिसफंक्शन के लिए जब पेशेंट हमारे पास आता है तो कई बार हम पेशेंट से जब हिस्ट्री लेते हैं तो समटाइम्स द पेशेंट गिव्स द हिस्ट्री related to the कि earlier they are having the proper erection, now they are not having the some, they are having some erection issues, smoking, alcohol, hypertension, all the things are correlated. So डॉक्टर मतलब इरेक्शन से रिलेटेड जो पेशेंट्स आ रहे हैं तो उसके लिए आप क्या ट्रीटमेंट सजेस्ट करते हैं और क्या क्या इन्वेस्टिगेशन होने चाहिए?
Okay. देखिए, मैं एरेक्शन के लिए सबसे पहले हमें डायग्नोसिस क्लियर करना बेहद जरूरी है कि एक्चुअली पेशेंट को प्रॉब्लम क्या है। जैसे कि हम जानते हैं इरेक्टाइल डिस्फंक्शन वैस्कुलोजेनिक कॉज होता है, एंडोक्राइनल कॉज हो सकता है, साथ में साइकोजेनिक एंड रिलेशनशिप इशू कॉज भी हो सकता है। तो फर्स्ट वी हैव टू रूल आउट द कॉज ऑफ द प्रॉब्लम। I have seen many of the cases where young cases there is a hyperlipidemia. Due to hypercholesterolemia, the patient are suffering from the erectile dysfunction. That's place, and we have seen the many of the patient we have a hypertension, diabetes. So we have to also manage the such type of issue where the erectile dysfunction is creating the problem. So we have to focus on that. That problem also culprit to create the erectile dysfunction. So we have to manage first of that. If there is a young patient, we also screening the blood pressure. We are also screening the random blood sugar. We are also screening the thyroidal issues, and we are also screening the any mental medication. If the patient is taking any of the psychosomatic medications, antidepressant, anti-anxiety, benzodiazepine, sleeping pills, so they are also creating the erectile dysfunction. So we first diagnose the patient, then we treat the patient. That's it.
या एब्सोल्युटली करेक्ट। जैसा कि डॉक्टर सिद्दीकी ने बताया, बिकॉज दीज डेज वी आर गेटिंग सम पेशेंट्स लीन एंड थिन आल्सो, मतलब ओबेसिटी नहीं है, हाइपरटेंशन नहीं है, यंग पेशेंट्स आ रहे हैं हमारे पास 24-25 साल के, जो बोल रहे हैं कि मैम पहले सब कुछ ठीक था। तो जब हम जैसे सारी हिस्ट्री लेते हैं, जैसा कि डॉक्टर सिद्दीकी ने बहुत अच्छे से मेंशन किया, हाइपरटेंशन का लिपिड प्रोफाइल के लिए हम पूछते हैं, तो हम पेशेंट से प्रॉपर हिस्ट्री लेते हैं तो कई बार सकता है कि हाँ, स्मोकिंग एंड अल्कोहल तो एक बहुत बड़ा कंट्रीब्यूटरी फैक्टर है ही है। और इसके अलावा जैसे मैंने बताया कि बहुत सारे पेशेंट्स हमारे पास ऐसे आते हैं जो किसी न किसी एंटी डिप्रेसेंट्स पे हैं और लॉन्ग टर्म से है, या कोई एंटी साइकोटिक मेडिसिन ले रहे हैं। तो डॉक्टर, क्या आप कुछ स्पेसिफाई करोगे कौन से ऐसे मेडिसिन है जिनका स्पेशली ऐसा ये साइड इफेक्ट रहता है कि पेशेंट को इरेक्शन या इजैकुलेशन में प्रॉब्लम?
Okay. Ma'am, I want to also discuss today the era of the drug abuse. Youngsters
यस,
are taking many of the drugs are there. That's why I have seen many of the patients where they are taking the cough syrups as a drug abuse. We have seen many of the sleeping pills, many of the alprazolam, clonazepam, many benzodiazepine as the sleeping pills. They are using overdose. Sometimes they are also taking any SSRIs, which is just a treatment of the depression. They are taking the SSRIs. They also cause the such type of the issue in the male. Also, erectile dysfunction also creating such type of the issues are there. Some paroxetine, many of the SSRIs which creating the erectile dysfunction. I know SSRIs are causing the delaying erection. We are treating for the premature ejaculation, but as a paroxetine also creating the erectile dysfunction due to this is a nitric oxide inhibitor जो नाइट्रिक ऑक्साइड को कम कर देता है। तो इट्स रियली रिक्वायरमेंट टू जस्ट stop the such type of the medication. And if youngsters are taking any type of the antidepressant, taking any type of the drug abuse, so we also consult the psychiatrist and ask the doctor about that problem. If they are taking such type of the medication and facing the that problem is so much exaggerated nowadays, so we have to discuss the doctor, and doctor will change that medication. So it's very good. We can easily manage the such type of the drug induced erectile dysfunction. We can easily manage that problem.
थैंक यू सो मच, बिकॉज ये एक बहुत ही इम्पोर्टेंट पॉइंट है, क्योंकि बहुत सारे पेशेंट्स ऐसे आते हैं जो किसी न किसी ड्रग पर हैं, लॉन्ग टर्म से किसी मेडिसिन पर हैं, या किसी बीपी की मेडिसिन पर है, जिसके भी साइड इफेक्ट से उनको ऐसा इरेक्शन का और इसका प्रॉब्लम होता है। डॉक्टर, अभी ऐसे ही बहुत सारे पेशेंट्स आते हैं, जैसा कि वी ऑल नो, स्टार्टिंग फ्रॉम द पेनिस साइज, so lot of the patients are coming, madam, earlier my penis size was good, now it has been reduced, or what is the criteria you suggest that about up to which the penis size is normal, and when we are saying that it is
Yeah.
less?
Yeah. First, we have to think about our health. If our health is good and our routine is good, so we can easily just think the penis size is so good erection are there. Some youngsters are taking many of the liquor. Sometimes they are taking more smoking. So that time there is a arteriosclerosis taken place. Such type of issue, if you are facing that till adolescence, you are facing the size issues. So we have to think what's the size is required for us, because you are comparing the such type of the pornography, and you are just so much worry about that, because now youngsters are so much ambiguous. They are just comparing many of the things are there, and if they are just indulging such type of the pornography addictions, they are just watching such type of the thing. There is a race difference. If you say there is a negro man, they have just a race difference, there is a casting difference are there, so the penis size is also different size are there. So we don't be worry about to don't be compare the unmatched cast, and we also think about what's the right size. As my doctor Ritu Santani ma'am always telling about such type the issues, that's only 2 to 3 inches penis are normal size, and there is a vaginal orifice where there is a 2 to 3 inches live tissues are just present. So only for the penetrative sex and for the orgasmic for the female, 2 to 3 inches penis is sufficient. But the youngsters are watching the pornography, they are just watching the 10 inches, 8 inches, and they are more comparison on that. That issues creating the psychogenic issues, and they are so much depressed that they are also creating the own self as a personality anxiety. After personality anxiety, when they go, they are unable to attempt the penetrative sex. They feel there is size issues are there. But the actually problem are we don't be think about, and we also just maintain our brain, and we also think of positivity. What size is requirement? We also focus. If you have any issue, yeah, I have seen many of the cases where there is a micro penis. In the micro penis, ma'am, there is a 2 centimeter, very minute penis. Age is 22, 24 years. So many of the cases there is a hypogonadism are there. There is any another disease are there. So there is a micro penis another thing. But the normal era, our youngsters are coming our clinic, and they have a very good size, 5 inches, 6 inches. But they are comparing with the another friends, where they are comparing with any they are another pornography actor. So they are creating the more myth in that brain. That's the culprit of that. We have to remove the myth. What size is requirement? Suppose if there is a midget which has a very short leg, but he can easily walk, वो चल सकता है. So there is no requirement of that. If the function is good, if we are just getting the orgasm, so that is important. We only think about that the size. Size doesn't matter. The matter how to you play with the partner, how to indulge a partner, how to give your partner as the orgasmic phase, and you just how to foreplay with the partner. That is so important.
Very true, very true. So that's why once we start the counseling and seeing the patient, we always tell the patient that erection is more important compared to the size. If you are satisfying your partner is getting properly satisfied, then nothing, no harm. अभी जैसा कि डॉक्टर सिद्दीकी ने भी क्लियर किया बिल्कुल कि माइक्रो पेनिस हम 2 सेंटीमीटर से कम होता है तब हम बोलते हैं, तो पोर्नोग्राफी को देखकर साइज के लिए उससे कंपेयर नहीं करना है। डिफरेंट कास्ट में, डिफरेंट उसमें अलग अलग जोन्स में अलग अलग रहता है, उनका बॉडी फिजिक अलग रहता है, तो उनके साइज ऑफ पेनिस अलग रहता है। तो ये एक बहुत कॉमन
One,
ये भ्रांति है जिसको
one point, ma'am. One point. I have seen many of the youngsters. They are suffering such type of the myth because of they are the watching such type of the penis increase pills, penis increase ointment, many of the things where there is an extraordinary size is shown by the adding. So that's also culprit about it. They are showing because due to huge of that such type of the maximize due to picturization and digitalization. So that is not a real. That's a fake. But they are just selling their own medicine. So they are showing such type of the things, which is also creating the myth in youngster brain. So we have to think what is right, what is wrong. We have to give the more sex education for youngster. We are providing. Dr. Ritu also giving the more sex education. I am salute of ma'am. That's it. Thank you.
नहीं, थैंक यू डॉक्टर सिद्दीकी। सो अभी क्योंकि इसके माध्यम से हम लोग यही बात क्लियर करना चाहते हैं, क्या होता है बहुत सारे पेशेंट्स गूगल पे बहुत कुछ पढ़ते हैं, बहुत कुछ देखते हैं, उनको क्या लगता है कि जो गूगल पर लिखा है वही सब कुछ सही है, डॉक्टर जो बोल रहा है उसकी कोई वैल्यू नहीं है। हर एक चीज के लिए अलग अलग रहता है। सो व्हाट वी आर गिविंग द ट्रीटमेंट बाय सीइंग द पेशेंट, पेशेंट के हिसाब से हम दवाई चेंज करते हैं, डोज कम करते हैं, ज्यादा करते हैं। कोई ऐसा टेलर मेड प्रोटोकॉल नहीं होता है। लोगों के दिमाग में क्या रहता है कि नहीं, वी हैव हर्ड समवेयर, वी हैव रेड समवेयर दैट साइडोनाफिल 25 mg. Today got one patient, Dr. Siddiqui, the patient is taking 200 sildenafil,
Yeah.
200.
Yeah.
So that is too much. मतलब अभी कहाँ हम 25, 50, 100 तक देते हैं, and patient is a known case of the hypertension, रेमिप्रिल पर है और साथ में वो इतना हाई डोज ले रहे हैं। तो मैं और डॉक्टर सिद्दीकी ये जो सेक्स एजुकेशन के बारे में चर्चा कर रहे हैं, उसका पर्पस यही है कि जो है कि इतना ज्यादा डोज आप बिना डॉक्टर की सलाह के ना लें, डॉक्टर जैसा आपको सजेस्ट करेंगे उसके
Ma'am, one
हिसाब से
point. Yeah,
जी
we are just adding one point. I've
हाँ
seen many of the youngsters, they are going to such type of the medical shop for the purchasing of condom, but the shopkeeper also providing such type of their Viagra, such type of the medication, and saying that say it's a time medication, it's a time increase medication, it's a pleasure medication, and they want to sell the medication. And really that youngster have no any problem, his time is well, not premature ejaculation, not erectile dysfunction, but still that youngster are taking such type of the PD5 inhibitor like sildenafil, manforce, many of the medication they are taking. So when he is normal but still they are taking the medication, so they just depend on the medication. Because of taking that medication there is a more corpor cavernosa blood supplies are there is a more harder erection are there, so they feel that due to this medication I am enjoying more and more, and they are addict on that medication, but still they are not required of that guy. So they're just taking that medication where they are not taking that medication. They are feeling I am such type of not erection. I have erectile dysfunction. So they are taking that medication and creating the disease. Firstly, they are
ट्रू
normal, they are not diseased, but they are taking that medication and they are suffering such type of the more stigma on that brain, or they are not getting such type of the erection, so they are again taking. So such type of issues we have seen many of the cases where there is a carpal cavernosa, where is a normal carpal cavernosa, they are got damaged due to overdose, due to overdose. We have also seen many of the youngsters optic neuropathies, sudden blindness with this type of the medication. So you all are requested, youngsters, don't take medication without doctor prescription. If you have requirement, we doctors increase the dose day by day as the response as we required. But you youngsters are taking the medication as maximum dose, which is very harmful. Madam, I have seen many of the young, I have seen one young guy which really big issue. If taken the just 200 mg of the sildenafil, and due to sildenafil PD5 inhibitor, the blood pressure stroke goes down, and the blood pressure was 40/20, and due to hypotension, patient goes death. Okay, so that situation, I have seen one also point. If a young patient are taking the such type of first time overdose, there is a priapism. वहां पर पेनिस इरेक्ट हो जाएगा और वो फिर लूज नहीं होगा. That causing permanent impotency or permanent damage of the penis. That's way. So this type of the problem we are facing in the youngster. So you all are requested not to take the medication without doctor prescription.
वेरी ट्रू, वेरी ट्रू. थैंक यू फॉर एक्सप्लेनिंग सो नाइसली. तो फ्रेंड्स, जैसा कि अभी डॉक्टर सिद्दीकी ने भी बताया, तो कोई भी मेडिसिन आप अपने आप या ऐसे जाकर ओटीसी प्रोडक्ट की तरह ना खरीदें. और जब आप डॉक्टर के पास जाएं, प्रॉपर डॉक्टर आपको चेक करेंगे, प्रॉपर डोजेज बताएंगे, क्योंकि हर एक दवाई के साथ में उसके कुछ साइड इफेक्ट्स भी होते हैं. तो जो डॉक्टर आपको ट्रीट कर रहा है, खाली आप पढ़कर ऐसा ही एक दवाई नहीं ले सकते. जो डॉक्टर आपको ट्रीट कर रहा है, वो उसके हिसाब से आपको डोजेस देगा और उस हिसाब से आपको ट्रीट करेगा. ये बार बार क्वेश्चन लिख रही हैं वंदना मिश्रा. वंदना मिश्रा, आप अपना क्वेश्चन यहाँ पर लिखिए, हम उसका आंसर देने की कोशिश करेंगे. हाँ, ओके. चलिए. हाँ, तो अच्छा, इसके अलावा ही डॉक्टर सिद्दीकी, बहुत सारे पेशेंट्स जो इसके लिए बताते हैं प्री मैच्योर इजैकुलेशन के लिए. So what are the important points we have to remember while we are taking the history for that, and what's the guideline of the treatment you advise?
For the premature ejaculation, you are
Yes,
asking that
yes,
thing.
yes, yeah.
Yeah. First we have to think about the premature ejaculation. The man real are there to more stay long. They are just watching such type of pornography where there is the extended time, which is not real time. Because in Indian scenario, the IELT time, intra-ejaculatory latency time, is 3 to 5 minutes. Okay, but they are just watching the more vigorous time, so they are more confused. So first we think about if there is a time excess, penetrative sex is the more than 1 minute, so it's a normal time. Because of many another people, I have seen many of the cases where the time vary. So there is, you don't be worry about it. First we have to take the history about the time, and sometimes there is a time extended than 1 minute, but the partner are not satisfied to each other. Female partner is not going to orgasmic phase. So we also treat such type of the patient as a premature ejaculation. Because when the male ejaculate, he's relaxed, he feel the orgasm. But if there is a 1 and 2 minutes of the time of penetrative sex, but the female is not reaching orgasm, so we have to treat also such type of the patient. We have to extend the such type of the time. So it's a really requirement. I have seen many of the cases where there is the spinal trauma are there, also causing many of the issues are there. There is the psychosomatic issues are there. Sometime where there is a relationship. I have seen many of the young cases where the female are torturing the male. That's why you are important, you are not doing performing. My friend are saying about that, so you are not as a macho man. So that's such type of the performance issue trigger the men's brain, and they just got such type of the performance issues, and really premature ejaculation occurs. So I have seen many of the cases. I have just say the such type of the way वो चंद गड़गड़ाते बादल आए मेरी दहलीज पर, बर चंद बूंदाबांदी करते हुए चल दिए. The way to have a sharing, the mean is there. You have to cooperate your partner, you have to satisfy your partner, and she's not reaching orgasm. That is very important. If the male is the type of the issue, and the premature ejaculation is surely treatable, and before penetrative sex, we go for the foreplay. If the female is not so satisfied, not getting orgasm, we after go for the after play. So such type of the way we can easily manage the premature ejaculation, and it's really cause the erectile dysfunction. So we have to think the erectile dysfunction and premature ejaculation is overlap. So we have to confirm it, the male have erectile issues or PMA issues. So we have to more confirm about that by the history.
Thank you, डॉक्टर सिद्दीकी. आई थिंक वी विल वाइंड ऑफ विद दिस, क्योंकि मेरा एक नेक्स्ट शो के अग्रवाल के लिए प्लान है अभी 5 बजे के लिए. और थैंक यू सो मच. और मैं और डॉक्टर सिद्दीकी फिर जुड़ेंगे. डॉक्टर सिद्दीकी के हिसाब से, मेरे हिसाब से टाइम डिसाइड कर लेंगे हम लोग, और हम लोग एक बार फिर जुड़ेंगे. डॉक्टर, वी विल डिस्कस इन दैट टाइम अबाउट द डाइट एंड सेक्स, क्योंकि बहुत सारे लोगों की बहुत सारी क्वेरीज होती हैं.
Yeah, diet and sex, yeah.
तो उसके बारे में हम डिस्कस करेंगे। अगर आप फ्री होंगे परसों तो वी विल कनेक्ट।
Sure, ma'am. Sure, ma'am. On Friday, yeah, we will connect. Sure.
यस यस
Thank you.
यस।
Thank
ओके
you.
ओके,
All of
थैंक
you.
यू सो मच।
Okay,
बाय
thank you.
बाय बाय।